Following the 2014 Ebola outbreak in Sierra Leone, a key challenge for the health system was the rapid collection of health information to alert of a disease outbreak. It quickly became apparent that we needed a better way to collect, share, and utilize information.
At the moment, most of the information or the health information or data that we get from the primary healthcare units are usually in the form of written hard copies. And it takes a long time for the data clerks to enter all of these data into the health management information system that is here at the district level.
Paper-based records present challenges that make health and disease data reporting time-consuming and error-prone, resulting in unreliable and incomplete information. The Electronic Integrated Disease Surveillance and Response System, or e-IDSR, was created to improve the flow of information within health systems through a pilot in Sierra Leone's Port Loko district. Limited data collection, accuracy, and timeliness can be the difference between coordinated, life-saving health services for the most vulnerable. Paper-based data collection slows down the Ministry of Health's ability to use health resources to enhance public health.
In order to stop an outbreak before it happens, it's important that we have a really well-functioning disease surveillance system working here in Sierra Leone. So in order to make sure that we had a system that was functional and worked in the constraints that is rural Sierra Leone, we developed a system called e-IDSR, which is a mobile data collection tool that works offline and syncs opportunistically with a server in order to collect vital information from health workers.
It is only when e-health came and with the support of the CDC, giving the technical back of 2 years, that we were able to have an NGO that is really biased towards surveillance.
The implementation so far was a successful one. It started with 6 facilities being piloted, and these 6 facilities we are taking as a case test because the 6 facilities, some were having challenge with the network and others without network challenge. So like after piloting these 6 facilities, we jump on to roll out the 112 facilities so far in Loko, and it was a successful one so far, moving from the paper-based to the electronic e-IDSR.
The unique part about e-IDSR is that, it allows for this monitoring to happen in real time. It allows for this monitoring to happen across different levels. So from the facility level to the district level to the national level, all the partners are involved in real time. We're not waiting for a paper to go from the village to the district and then to the national. So that's kind of the innovation of e-IDSR.
Some of the challenges encountered during the use of this device is of course one, that of the mobile signal.
Network coverage, I tell you, for some of our PHU staff is a big issue. Most times, some of them have to leave their PHUs.
With the challenges we have, it will be the good thing and the best thing if the Ministry of Health and the other ministries like the Ministry of Information will come together to address the challenges we have in communication, data and networking. That is the most important challenge we have, and bringing on board all the partners in supporting this project.
Despite some early hurdles with connectivity, e-IDSR has enabled sweeping changes in how health facilities in Port Loko gather, organize, and act on health information.
Transitioning to e-IDSR will bring a lot of benefits to the health system because it will improve the quality of our health information.
It has also built the capacity of our staff. In the sense, very many of our staff were not used to using smartphones. When they started, they had challenges, but now they are on track.
It helps you for identify particular disease in the community and report them immediately. And this reporting system is very, very short and faster.
Main benefits to we own facilities that it's quick, easy, and accurate.
It has helped us to improve our interaction with our PHU staff. Interaction has been very good, especially in the area of timely reporting of epidemic diseases for immediate response.
But as at now, at least I can be seated in my office and then send accurate reports, and also other things like we are using these devices in other health-related activity within the district to share information. So these are some of the benefits we've achieved in using this device.
At the moment now, I believe from the last week that we just had for reporting, we had 90% reporting rates from the Port Loko district, and of that, something like 80 or 85% were timely then. So they reported their reports before Monday at noon, which was expected by the Ministry of Health. So I think it's definitely at a point now where it's quite successful.
I'm hopeful this gets more widely adopted within Sierra Leone. I think it's been a really good project in terms of doing something new and sort of pushing the boundaries of DHIS2 and data entry in a low connectivity environment. I think we've proved that in one district at least, this can work really well. So yeah, I'm hopeful that it gets expanded into other districts, and also be great to see it being used in other countries.
One of my recommendations is boosting up the network connectivity, because that's a very, very vital part of the system.
eHealth Africa is looking at making e-IDSR a more robust tool so it can be used for disease surveillance across West Africa.
This is the way forward.
Evelyn Castle, yes to e-IDSR.
Yes to e-IDSR.
Yes to e-IDSR.
I say yes.
And I say yes to e-IDSR.
Yes to e-IDSR.
Yes.
Yes.
Yes to e-IDSR.
Yes.
Yes.
Yes to e-IDSR is the way forward.